Now for the next type of poisoning, which we'll be looking at what is known as two type of poisoning, right? Lead poisoning and also iron poisoning. Lead poisoning and also iron poisoning. Okay, so let's quickly look at these two and look at how far they could actually take us. So lead poisoning and iron poisoning is as follows. We'll look at it one by one. So first is the lead poisoning. So you should know that lead poisoning, mainly you are focused on the sources. Where could somebody be exposed to lead to the level that they are actually getting poisoned from it, you know? So this occupational exposure, you work in a battery manufacturing place, you work in a place where they make paints, you work in a place where they make all those plumbing materials or smelting. Sometimes it's environmental exposure, an old house paint, you know, because there's lead in paint, you know. So children are actually vulnerable to it, do you understand? So pathophysiology is when lead gets into your body, it interferes with what the formation of heme by inhibiting enzymes like the gamma ala dehydratase, also the ferrochelatase. So to disrupt how calcium is being, you know, arranged in your body and all. Do you understand? So they usually cause all those cognitive impairment, irritability, peripheral neuropathies, you know. So hematological, you know, they could cause all those microcytic hypochromic anemia. In the stomach, they could cause all those abdominal pain, you know, constipation, you know. In the renals, it could cause all those interstitial nephropathy, hypertension. So on the skeleton, they could cause all those lead lines on gums and also metaphysis. So treatment is what? EDTA, you know, so calcium disodium editate, and also the dimercaprol, also the succimer. Okay. So how about the iron poisoning? Where could you actually be exposed to iron? So look at this image very well and how it could actually affect different organs, you know. So it could be accidental ingestion of iron tablets in children, could be overdose in adults, like, you know, somebody's trying to do some drug abuse and the drug contains iron. So pathophysiology is you have a lot of iron and it's corrosive to the GI tract, you know. So it could lead to hemorrhagic gastroenteritis. So it could actually affect your GI tract. You know, systemic absorption could now lead to mitochondrial dysfunction. You know, so iron deposits in the liver, heart, CNS, all those ones, you have symptoms associated or related or as the type of organ that is affected. You understand? So clinical features just depends on the organ affected, but in general, the GI is mostly affected. So you have vomiting, diarrhea, abdominal pain, and GI bleeding. Latent phases like all those apparent recoveries, you know, then, you know, shock will follow, metabolic acidosis, and all of that. So treatment is basically you are trying to make sure that that person is still breathing, circulation, you know, bowel irrigation, and you give a drug that will basically pick up that iron, okay, deferrosamine, okay, to bind iron, it will excrete it in urine, okay, thereby reducing the concentration of iron in the body.